begin with the parents. So Tanis and Lindsay, the first question I have is, what are key challenges that children and youth and their families experience, which healthcare providers need to do better at addressing?
Yeah, so for myself, I think one of the biggest challenges was feeling disempowered in my role as a mom. So our specific situation, there was a lot of really intense medical decisions that had to be made right away, and it was in crisis. And that gave me a huge sense of trust in the medical system, which I'm so thankful for. And it also made me feel like my role as a mom, my like attunement with my daughter was just like totally stripped from me because I no longer knew what she needed or knew how to care for her best. Yeah, it was hard to advocate for her when it was like a whole new world being a transplant mom. It was like learning a new language with all of the medications and ways to care for her. So yeah, the way that healthcare professionals came alongside me as her mom and trusted my intuition, encouraged me to care for her in small, simple ways. So like changing dressings, giving medications, even when we were in the hospital, caring for her in those ways. And also the healthcare professionals that just saw our situation as very unique and gave room for questions, even when they were really kind of silly, gave room for irrational fears that I had, just made me feel like a very unique individual, because for me, this was the first time I'd ever heard of transplant, ever heard of 99% of the things that were going on. So yeah, and then also for her, she was too young at the time to really advocate for herself or be a part of any of the decision making, but as she gets older, it was 6 years ago, so now she's 7, and so when we are in hospital or in clinic, when healthcare professionals give her a chance to make decisions on her own, even if they're as simple as like the way you do things or the way she sits or anything like that, gives her a sense of autonomy and also allows me to give some of the decision making to her. So yeah, I think that it was like the whole situation, I felt very like out of control in a situation like parenting that I'd always felt very in control of. So yeah, medical professionals that gave me back that autonomy, like giving me choice, giving me space to ask questions, and yeah, treating me as an individual as opposed to just like one of their patients.
When I think of the challenges, when I look back at our experience, I really focus a lot on mental health. I feel like we were taken care of so well by our transplant team, but I felt the mental health aspect was severely lacking, that there almost could have been another role on the team. You know, they take care of nutrition, there's physio, there's all of that, but then you're thrown into this world that you never thought you'd be a part of. And you're told, you know, to be strong. And you're like, I don't know how to do this. I've never heard of half the terms. You know, you're in fight or flight all of a sudden because you're told, you know, we don't know what the outcome is going to be. You see traumatic things, like if we had to live, I think the longest was a 7-month stay. So you're constantly immersed in this traumatic environment where not only for your own child, but you're seeing other people. And it's really hard to navigate. And then post-transplants, now, you know, you have trauma, you have PTSD, you have stress, and they're like, congratulations, go off, and now it's hitting you. And I feel like you're always waiting for the other shoe to drop. And, you know, like we have our annual calf coming up, and it weighs on you. And you're not really given much. There's not much support. There's a severe lack in the medical system, I think, for the mental health aspect of it. So personally, I guess to tie it into this talk here, for George's first transplant, the only thing that I could think of to get control was like, okay, let's start raising money towards research, because I don't know what else to do. I have no control in this situation. So that's kind of how Big Gifts came to be. My brother-in-law works for the running room. He's like, let's put on a run. I'm like, great. And then people started giving money, and then, you know, ask what do I do with this money now? And then our team helped work with us about, you know, these are some areas that we could help fund, or this is the CDTRP, or then I met you and you introduced me to more. And that was my way of dealing with the anxiety, because we just didn't have the other supports to help us go through it. So if you notice big gifts as having lots of events going on, there's probably some anxiety going on. And so that makes me feel in control, that I can do something about my son's outcome.
Thank you. Hello? I'm not sure if this is working. Oh, now I see it's working. Yeah, thank you for sharing your experiences. Just as a follow-up question, what do you wish that healthcare providers knew along the journey throughout their transplant?
I think I kind of touched on it, but I think it was so interesting to me to walk into the hospital or be in the hospital for months and months at a time and realize that all the healthcare professionals, this is like their job, but it was my life. Like I couldn't escape from it. I had no choice over it. And so I think seeing my story and my daughter's story as very unique and individual made me feel like I wasn't just another case for them, and I wasn't just another transplant, or wasn't just another transplant. I think also the integration part of transplant was very difficult. Lindsey kind of touched on it, but just like you get the transplant and then they're like, congratulations, you're good to go. And it felt like that. I remember suddenly like realizing that the hospital wasn't where I really wanted to be anymore. Like for so long, it was like our lifeline. It was like, I don't want to be anywhere but the hospital. And then there was that shift where it was like, oh, I can do this. I can be outside the hospital. I actually don't really want to be there and need to be there anymore. So, yeah, realizing that integration takes a long time. It's not like a sudden switch.
Yeah, to go off on that, I'm speaking from a caretaker perspective. The trauma is a chronic condition, just like the transplant is. We were saying, I know we joked, it's kind of dark humor that we're a little broken now after, but it stays with you. And so just remember that even after the transplant, like you say you're okay because that's what people want to hear, but you're not truly okay. You know, that's your child. It sits with you, and you know that every year is a gift. And then we hold on to, the second thing I want to say is every word you guys say, we really hold on to that. And so I was lucky enough to have a psychologist while we were in hospital, Hope. Like I really needed every day at rounds. It was the most, I looked forward to it and I hated it because you never knew what you were going to get. And if it was a day, maybe I understand, maybe the physicians were really busy and, they say all the points, but we listen to everything. We watch your movements, we watch your tone, and something you say could really change the trajectory of the day or how we're feeling. And so in order to stay strong, I think I just want to remember to stay hopeful and remind us, because that's the only way I think as a parent, like to go forward, for me anyways.
Wow, thank you for sharing that. So maybe I'll pass it over to you.
Yeah. Thanks, Simon. And thanks to both of you for sharing that. And just a really good reminder of how important every single interaction we have is. So that's excellent. This time is going so fast. We're going to transition to a slightly different topic, which is actually transition. So hello, Grecia, at the end of the table. We're kind of at opposite sides. So yeah, I'm wondering a little bit about what you have to say about transition to the adult program and just some of your thoughts around that, please.
So growing up in the pediatric system and everything, it was always like the doctors are always taking care of you and your parents are there in that part. And every time when you're like in that process, you kind of start like learning a little bit by little, everything about taking your medication, going to nouns, many things. And once you're in that transition, that process is just becomes so rapid that you're just like, oh my God, what am I doing now? So it just becomes that part that is also exciting because you go through that part of adulthood and you're just like, oh yeah, I'm gonna be independent now. But when you start taking care of responsibility for your health and making sure that you're feeling healthy, you're taking your medication, you're doing all that, it's just a big scare because you don't want to miss out anything. You also feel that of the health system sometimes. You're kind of like, okay, we're going to help you out, but you need to be extremely responsible. I think that's a big part when transitioning was my parents because they always wanted to explain things. I do remember one time where I didn't have any results for my medication. I was just like, what am I gonna do? So panicked completely and stressed, and I'm like, what should I do? What should I do? And it's just like, call your doctor, call your nurse that you have on the phone. I called her in and she's like, you know what, Grace, we don't have your medical records anymore, so we can't do that. So the best part of that is that she guided me through what to do in that process. She told me, you know what, call the receptionist of the adult care and then they'll help you out further. I call in and it's like, okay, I call in, everything went well. I got medication drafted and everything. So I think on that part, transitioning isn't just about transitioning your documents or anything about that. It's also about making sure that the transition from the patient is successful and that they feel really capable of then having a phone number that is like essential, like their pharmacist number, a doctor number, an emergency number, because there's times where there's something in the process that is happening, like the time when I transferred, it was COVID. So during that part, it was just like everything shut down, we had zero contact with people, all my appointments were on Zoom, so it was just like, okay, how many phone numbers if I get sick, what should I do? So nowadays I'm taking care of myself and all that. More easy to do it, like.
Thank you for that. That's great. Great information. Do you have any thoughts on advice you give someone else who's facing transition or something that maybe could have been done differently during yours? And I know you said it was around COVID, so that's just, hopefully something we don't have to repeat again, but any thoughts you have would be great.
I think it started teaching patients early on how to order medication, the name of your medication, your dosage, which doctors, the difference between doctors and nurses above too. Which is the main nurse, the other nurse, and things like that. It's also a good part of transitioning. When I was in the process of that, was always in the moment, like, okay, this is your place to try. I need to show me which are your medications. So one time when I took up my medication to the pharmacist, I checked my blood pack, there was a medication missing. Okay, that's when you need to know all the medication, make sure that everything is there, because sometimes as a comes to situation, we have the medication that needs to be strict. That way we take it as a transplant. So I think teaching kids early on how to take care of themselves will help a lot to that point. Even though when going to an appointment, you have this levels of blood work and everything, and okay, this is the range that we want me when you have blood work to make sure that you're okay. When transitioning, I think one of the big things that helped me the most was my health records, which was when it was making sure that all my levels were doing okay. Some doctors and nurses are very busy with daily work that they don't even call you or things like that, and you're not aware. So when looking at your blood work and seeing, okay, particularly this number looks right, this looks wrong, okay, I should give them a call in order for them to know that they saw it. Nowadays, I understand more about if they don't give you a call, it's because it's looking well. But when I was transitioning, I have no idea that that was the case. But yeah.
Thanks for that. So early preparation, and knowing how to use a microphone is key. It's on now. Okay, thank you. Early preparation is key. And knowing how to use technology, which I don't, is also key. So thank you for that. I'm going to pass it on to David now.
Thank you. What great insights. I'm going to turn it to Sean, if I may. Sean, can you talk about issues such as trauma or mental health experiences that you've encountered along the way?
Yeah, this is, I think 2024 is sending me an interesting message. Dr. Urschel asked me to speak at a pediatric transplant camp earlier this year. And then I was on the planning committee and Lorraine still put me on this panel. And I don't feel like a pediatric anymore. I am a grandfather. I am old as shit. But the cool thing about sitting next to two moms is the first person I went to talk about, what story am I gonna tell today, was my mom. And my mom's 81 now, and so those are interesting paths to go back to 45 years and say, what was your experience like? I would say I'll tell the story first, and I think the second question you asked to them was, what do you wish your healthcare providers would know about those experiences? So first of all, I have been a chronic kidney disease patient my entire life. I lost my left kidney and part of my right before I was a month old. So I've lived this journey, even though I didn't have a transplant till I was 28. The tough thing about going through a lot of this was a lot of procedures. Lindsey touched on not just the transplant, but it's all the testing, it's all the procedures, it's all the everything. I have an extremely vivid memory from 1979, 8-year-old Shawnee sitting. So I'll give you a little bit about my diagnosis. I had post-urethral valve blockage, so down in the urethra I had a blockage. And so as a result of that, I had a ureterostomy until I was 9 years old. At 8, we were looking to see if we could get that reversed and so that I could pee normally, but essentially I had not peed in 8 years. I had to go in for a number of tests that were done at that time in the late 70s. And sticking a Foley in when you haven't peed in 8 years without anesthetic is something that will stick with me forever. And I can still to this day remember the faces, the eyebrows, oddly, of some of the care practitioners that were in the room that day. And so I guess I just want you to, I think what I would want people to know from that one experience was to this day, that is still a 20-pound rock I carry in my backpack. When the program calls me up 3 months ago, and I'll use my one little metaphor. When the program calls me up 3 months ago and says, we want to do a cysto again, it doesn't matter what the procedure is. 8-year-old Shawnee, wants to curl into a fetal ball, and it's still there, and it'll always be there. I have started seeing a counselor in the last 18 months, and so those kinds of things are helping. But I think the thing I want people to understand is so much of our experience even happens from the time the first phone call comes in to schedule a procedure. From that moment on, I'm going to worry. From that moment on, I'm going to be, it's 75% of the trauma response in my experience. This is just anecdotal, just the Shawnee story, has been the anticipation more than the actual thing. I would say even the transplant was not nearly as traumatic as waking procedures. And the other piece I would put in a plug for, and this is more my mom's story. I remember the incident too, but fast forward 1 year from that when I was 8 years old, at 9, I got to have the ureterostomy removed, everything put back up. I did not understand everything that needed to happen. I wasn't excited about it. We drove by the Wetaskiwin Rest Center on the way here just yesterday, and I still to this day remember screaming at my parents, "If you love me, you wouldn't make me do this." When I talked to my mom about it, she remembers that to this minute. And at 81, that still is now carried by both of us. And so I think there's a lot to be said for what both Lindsey and Tanis said around, how you communicate things. Do you understand? Truly, I hope there are a whole lot more analgesics and things used on procedures today, or even just put me to sleep. That would be far more preferable, but those things do stick with you for life. So that's the piece I want you to know, that your acute care experience is my lifelong 20-pound rock.
Thank you. I so appreciate this panel for sharing their experiences to benefit us in our learning and to do things well and moving forward. So thank you. Maybe can I open it up to the entire panel as we come near the end of this portion of the panel, to ask you all, briefly, if you would, what would you like to come from this meeting in terms of moving forward and learning as we go forward?
I've been on a number of different committees and discussions and things like that, but I think if there is advocacy going on, I think one of the top things we need to advocate for is enhanced social work and enhanced psychological services for families as well as patients right from the outset of the first diagnosis, because there is, when I interact with my social workers in my program, they're overwhelmed. They're trying to just get the forms done and some really basic things like that. The mental health side of it, no one talked to me about it. I would say it was an absolute shock to me. I switched nephrologists just this last year because Dr. Cofield retired. At 52 years old was the very first time a nephrologist asked, "How's your mental health?" And I think that needs to be a much more frequent conversation with kids, with moms, with dads, and with adults in transition, with all of us.
Yeah, I would say the same thing. The mental health, it's impossible to know how to navigate this massive experience you're going through, and still it's hard. There has to be more for it, because there's just right now, there's just nothing. And it's like you're floundering. You feel like you're floundering all the time. It gets easier, but it's never gone. Yeah.
To go along with that, it's kind of goes on a different route, but just to briefly touch on it, in the mental health department is, I know for myself as well as my daughter, she was so little, and all of her experiences with the medical system were like, in terms of her body, were very like, she didn't have a control over what happened with her body. And I know for me, I didn't realize it till years later what she needed, but I wish that I would have implemented more like positive touch, or like things like massage, or things like ways of introducing touch that was like therapeutic, because obviously all the stuff that had to happen to her body was necessary. None of it shouldn't have happened, but it didn't give her a chance of like to give some control and therapeutic touch. So yeah, I would integrate that, just because I think that a lot of mental health stuff is stored in our body, and her being so young and not being able to talk about it, yeah, that would be helpful.
For the agency cheaper and all that, and then health and from my point of view, it's always enough where I knew people and friends who I had that went also through that transplantation process. And I was going through all that and everything. I was going to a camp where I will be talking to different kids about it, and will be more informed into how they're feeling and everything. And I worked in that camp during that time. And I think that having groups will help a lot into managing what it feels like, and everybody shares their story of how they're feeling, also for parents, because I think that they have a lot to share and a lot to talk about. From my perspective, I also have another group here with having this talk, and basically people tend to discuss things that we went through and everything. We will share cases on how to facilitate that transplantation process, because it's just so hard, and you just go through it and it's just rapid. And you hear doctors talking about it, but you don't hear it from somebody who went through with it. You basically are telling someone this is the process of transplantation, but they go through with it, which is understandable. You guys are doctors and everything, but the feelings that we get, the parents that we get, I think it's a lot of we need to put out there a group of people that could create a group for families to have each chat to one another and say, okay, this is what I felt, this was my experience. We don't tend to recommend anything, but we will tend to basically say, this is what I feel, this is how you feel, if you need anything, if you need a little bit of help, we're there to help you, things like that. I think with you guys, both, I think you guys can talk more about how your transition and how you guys felt as parents, like, when you're into camp after that transition with transplantation and everything. I will talk to kids my own age about how they feel, how they feel, and their their outcome into it and their recommendations of how they did certain stuff, like in my case, have a kidney transplant. I went to a kidney camp and basically we would talk about kidney things, from catheters to medications to, do you like this medication? Like this medication, you need it, it's horrible. So having those conversations with parents in my life, that also a lot of help because there come conversations from kids and you say, hey, mom, I heard this medication from one of my friends, I don't know if that can be helpful. That's where the kid will communicate furthermore with the parents and say, hey, mom, what do you think about this? I heard from a friend who has the same disability that I have, the same process that I have. I also went through colostomy and all that. And when that process was, I never had help into how to deal with the colostomy that I had no idea of so many things. So going and entering that group that I'm on basically has taught me a lot and has helped me teach other people about how to deal with the colostomy bag. Because I went through it, I know how it feels, I know that you're just so afraid about it, that now it's like so important to evolving more into patients, having a group of patients and a group of parents so they can discuss further more how to be able to continue.
Thank you. Rich insights, and thank you for sharing your experiences with us.